What if I told you that your body has been trying to warn you about a stroke for weeks, maybe even months before it happens? Most people think strokes come out of nowhere like lightning striking on a clear day. But here's the truth that could save your life or the life of someone you love. Strokes rarely happen without warning. Your body is incredibly intelligent, and it sends subtle signals that something isn't right with your blood flow to the brain. The problem is, we've been taught to ignore these whispers until they become screams. Today, we're going to explore 8 silent signs that your body sends you before a stroke occurs. These aren't the obvious signs everyone talks about, the sudden face drooping or slurred speech that happens during an actual stroke. No, these are the quiet, persistent warnings that happen days, weeks, or even months beforehand. By the end of this video, you'll know exactly what to look for, and more importantly, you'll understand why recognizing these signs early could be the difference between life and death, or between full recovery and permanent disability. Let me start with a statistic that might shock you. According to the World Health Organization, stroke is the second leading cause of death globally and the third leading cause of disability. But here's what's even more striking. The American Heart Association tells us that up to 80% of strokes are preventable. That means if we can recognize the warning signs and take action, we can prevent 4 out of every 5 strokes from happening. Think about that for a moment. 8 out of 10 people who suffer strokes could have avoided them entirely if they had known what their bodies were trying to tell them. The first silent sign your body sends before a stroke is something called transient ischemic attacks, or TIAs. Now, I know that sounds like medical jargon, but stay with me because this is crucial information. The National Institute of Neurological Disorders and Stroke describes TIAs as mini-strokes that occur when blood flow to part of the brain is temporarily blocked. The key word here is temporarily. These episodes typically last only a few minutes to a few hours, and because the symptoms disappear completely, people often dismiss them as nothing serious. But here's what makes TIAs so dangerous. They're like fire alarms going off in your brain. A study published in the New England Journal of Medicine found that people who experience a TIA have a 17% chance of having a major stroke within the next 90 days, with the highest risk being in the first 2 days after the TIA. Let that sink in. Nearly 1 in 5 people who have a mini-stroke will have a full stroke within 3 months if they don't take action. So what do TIAs actually feel like? You might experience sudden weakness or numbness on one side of your body that lasts for just a few minutes. Maybe you have trouble speaking clearly, but then it goes away. Perhaps you lose vision in one eye briefly, or you feel dizzy and unsteady for a short period, because these symptoms resolve completely. Many people convince themselves it was just fatigue or stress, but your brain is literally telling you that it's not getting enough blood and you need to listen. The second silent warning sign is persistent. Unusual headaches that are different from any headaches you've experienced before. The American Stroke Association emphasizes that while not all severe headaches indicate stroke, a sudden severe headache that's unlike any you've had before could be a warning sign of an impending stroke, particularly a hemorrhagic stroke where bleeding occurs in the brain. But we're not just talking about obvious debilitating headaches here. Sometimes the warning comes as chronic low-grade headaches that persist for weeks or months. These headaches might be accompanied by neck stiffness, sensitivity to light, or a feeling of pressure in your head that doesn't respond well to typical pain relievers. Research published in the journal Cephalalgia has shown that people who later suffer strokes often report a pattern of headaches in the weeks leading up to their stroke that were noticeably different from their normal headache patterns. The third warning sign is subtle changes in your vision that come and go. The National Eye Institute reports that sudden vision changes can be an early indicator of stroke, particularly when they affect one eye or one side of your visual field. This isn't necessarily about becoming completely blind in one eye, though that can happen during a TIA. Instead, you might notice that you're having trouble seeing objects on one side, or you might experience double vision that lasts for a few minutes and then clears up. Some people describe it as feeling like there's a curtain being drawn across part of their vision, or like they're looking through a fog that only affects certain areas. You might find yourself bumping into things on one side because you're not seeing them clearly. Or you might have trouble reading because the words seem to disappear or become blurry in certain parts of your visual field. These visual disturbances often get dismissed as eye strain or the need for new glasses. But they could be your brain's way of telling you that certain areas aren't getting adequate blood flow. The fourth silent sign involves changes in your speech and communication that are subtle but persistent. While sudden, severe speech problems are well-known signs of an actual stroke, the warnings that come beforehand are much more subtle. The Speech-Language Hearing Association describes these early changes as mild word-finding difficulties, occasional slurring of words, or trouble understanding complex conversations. You might find yourself searching for common words more often than usual, or people might mention that you seem to be slurring your words slightly. Especially when you're tired. Sometimes you might have trouble following conversations, particularly in noisy environments or when multiple people are talking. You might notice that reading feels more difficult, or that you're having trouble organizing your thoughts when you speak. These changes are often so gradual that family members might just think you're stressed or not getting enough sleep. The fifth warning sign is unexplained dizziness and balance problems that persist or recur frequently. According to research published in the journal Stroke, dizziness and balance issues can be early indicators of problems with blood flow to the parts of the brain that control balance and spatial orientation. This isn't the occasional dizziness everyone experiences when standing up too quickly. Instead, it's a persistent sense of unsteadiness, feeling like the room is spinning or having trouble walking in a straight line. You might find yourself reaching for walls or furniture for support more often than usual, or feeling like you're going to fall when there's no obvious reason. Some people describe it as feeling like they're on a boat that's gently rocking, even when they're on solid ground. The vestibular system in your inner ear works closely with your brain to maintain balance, and when blood flow to certain areas of the brain is compromised, these balance issues can be some of the first symptoms to appear. The sixth silent sign is sudden, unexplained fatigue that's different from normal tiredness. The American Heart Association notes that unusual fatigue, particularly in women, can be a warning sign of cardiovascular problems, including stroke. This isn't the tiredness you feel after a long day at work or staying up late. This is a bone-deep exhaustion that doesn't improve with rest and can't be explained by your activity level or sleep patterns. You might find yourself needing to take naps during the day when you've never been a napper before, or feeling completely drained after activities that used to be easy for you. Some people describe it as feeling like their energy has been completely sapped, as if they're moving through thick mud all day long. This type of fatigue happens because when blood flow to the brain is compromised, your brain has to work much harder to perform normal functions, leaving you feeling exhausted even when you haven't done anything particularly strenuous. The seventh warning sign involves subtle changes in your cognitive function and mental clarity. Research published in the journal Neurology has shown that mild cognitive changes can precede stroke by months or even years. These aren't dramatic changes like forgetting where you live or not recognizing family members. Instead, they're subtle shifts in your thinking patterns that might include difficulty concentrating, problems with short-term memory, or trouble making decisions that used to be easy for you. You might notice that you're having trouble focusing at work, or that you keep forgetting where you put things. Maybe you find yourself reading the same paragraph multiple times because the information isn't sticking. Or you have trouble following the plot of movies or books that you would have easily understood before. Some people notice that they're having more difficulty with tasks that require multiple steps, like following a recipe or managing their finances. These cognitive changes often get attributed to aging or stress, but they could be signs that your brain isn't getting the oxygen and nutrients it needs to function optimally. The eighth and final silent sign is numbness or weakness that comes and goes, particularly on one side of your body. The National Institute of Neurological Disorders and Stroke identifies intermittent weakness or numbness as potential warning signs of stroke, especially when these symptoms affect one side of the body more than the other. This might start as a tingling sensation in your fingers or toes that comes and goes, or a feeling of weakness in one arm or leg that lasts for a few minutes and then resolves. You might notice that your handwriting looks different, or that you're having trouble with fine motor tasks like buttoning shirts or typing on your phone. Sometimes one side of your face might feel slightly numb or weak, causing you to drool slightly or have trouble with certain facial expressions. These symptoms are often dismissed as sleeping in an awkward position or sitting wrong, but when they happen repeatedly or affect one side of your body more than the other, they deserve serious attention. Now that we've covered these 8 silent warning signs, it's crucial to understand what's actually happening in your body when you experience them. When we talk about stroke, we're really talking about your brain being deprived of the oxygen and nutrients it needs to function properly. This happens in one of 2 ways. Either a blood vessel in your brain becomes blocked, which is called an ischemic stroke and accounts for about 87% of all strokes according to the CDC, or a blood vessel in your brain bursts. which is called a hemorrhagic stroke. The silent warning signs we've discussed are often the result of your brain experiencing brief periods of reduced blood flow or small areas of your brain being affected by tiny clots or small bleeds that don't cause permanent damage but serve as warnings that larger problems are coming. Think of it like a dam that's starting to develop small cracks. Those cracks might not cause the dam to fail immediately, but they're clear signs that the structure is under stress and needs immediate attention. Understanding your personal risk factors is essential because stroke doesn't happen in a vacuum. The World Health Organization identifies several key risk factors, and the more of these you have, the more important it becomes to pay attention to these silent warning signs. High blood pressure is the single most important risk factor for stroke, affecting your risk more than any other single factor. The American Heart Association tells us that high blood pressure damages your blood vessels over time, making them more likely to become blocked or to burst. Diabetes is another major risk factor because high blood sugar levels damage blood vessels throughout your body, including the delicate vessels in your brain. If you have diabetes, your risk of stroke is 2 to 4 times higher than someone without diabetes, according to the American Diabetes Association. Atrial fibrillation, a type of irregular heartbeat, increases your stroke risk by 5 times because it can cause blood clots to form in your heart that can then travel to your brain. Age is a risk factor we can't control. Your stroke risk doubles every decade after age 55. But many other risk factors are within your power to influence. Smoking damages your blood vessels and makes your blood more likely to clot, doubling your stroke risk according to research published in the journal Stroke. High cholesterol contributes to the buildup of plaque in your arteries, including the arteries that supply your brain with blood. Being overweight, particularly carrying excess weight around your midsection, increases your stroke risk through multiple pathways, including increasing your blood pressure, affecting your cholesterol levels, and increasing your risk of diabetes. Physical inactivity is another significant risk factor that you can absolutely change. The American Heart Association recommends at least 150 minutes of moderate intensity exercise per week, and meeting this guideline can reduce your stroke risk by up to 27%. What makes these silent warning signs so important is that they give you a window of opportunity to take action before a major stroke occurs. When you experience any of these warning signs, especially if you have multiple risk factors, it's time to have a serious conversation with your healthcare provider. Don't wait for your next scheduled appointment. These symptoms warrant immediate medical attention. Your doctor will likely want to perform several tests to evaluate your stroke risk and determine if you've had any small strokes or TIAs that you might not have recognized. These tests might include blood work to check your cholesterol levels, blood sugar, and other markers of cardiovascular health. You might have an electrocardiogram to check for irregular heart rhythms, or imaging studies like a CT scan or MRI to look at the blood vessels in your brain and neck. One of the most important tests is a carotid ultrasound, which uses sound waves to create pictures of your carotid arteries, the major blood vessels in your neck that supply blood to your brain. This test can detect narrowing or blockages in these crucial arteries before they cause a stroke. If significant blockages are found, there are treatments available that can dramatically reduce your stroke risk, including medications to prevent blood clots and procedures to open blocked arteries. The good news is that recognizing these warning signs and taking action can be incredibly effective at preventing stroke. A study published in the journal Lancet found that people who sought immediate medical attention for TIA symptoms and received appropriate treatment reduced their risk of having a major stroke by up to 80%. That's an incredible reduction in risk, and it emphasizes just how important it is to take these warning signs seriously. Treatment might involve medications to prevent blood clots such as aspirin or other antiplatelet drugs. Your doctor might prescribe medications to lower your blood pressure or cholesterol or to help control diabetes if you have it. In some cases, procedures might be recommended to improve blood flow to your brain, such as carotid endarterectomy to remove plaque from your carotid arteries or stenting to open blocked blood vessels. But medical treatment is only part of the equation. Lifestyle changes are equally important and can be even more effective than medications in some cases. The Mediterranean diet, rich in fruits, vegetables, whole grains, fish, and olive oil, has been shown in multiple studies to reduce stroke risk by up to 30%. This type of eating pattern helps reduce inflammation, improves cholesterol levels, and supports healthy blood vessel function. Regular physical activity is one of the most powerful tools you have for preventing stroke. Exercise helps lower blood pressure, improves cholesterol levels, helps control blood sugar, and strengthens your cardiovascular system overall. You don't need to become a marathon runner. Even moderate activities like brisk walking for 30 minutes most days of the week can significantly reduce your stroke risk. Managing stress is another crucial component of stroke prevention that often gets overlooked. Chronic stress contributes to high blood pressure and can increase your risk of stroke through multiple pathways. The American Heart Association recommends stress management techniques such as deep breathing, meditation, yoga, or other relaxation techniques as part of a comprehensive approach to stroke prevention. Sleep quality also plays a crucial role in stroke prevention. Poor sleep, particularly sleep apnea where you stop breathing repeatedly during the night, can increase your stroke risk significantly. If you snore loudly, feel tired despite getting adequate sleep, or have been told you stop breathing during sleep, it's important to discuss this with your doctor, as treating sleep apnea can reduce your stroke risk. One of the most important things to understand is that stroke prevention is not just about avoiding one catastrophic event. It's about preserving your quality of life and your independence as you age. Even minor strokes can have significant impacts on your ability to think clearly, communicate effectively, and perform daily activities. By paying attention to these silent warning signs and taking action early, you're not just preventing a stroke. You're preserving your cognitive function, your physical abilities, and your independence. The statistics around stroke recovery underscore why prevention is so crucial. According to the National Stroke Association, about 40% of stroke survivors experience moderate to severe impairments that require special care, and 15 to 30% are permanently disabled. Only about 10% of people who have strokes recover almost completely. These numbers aren't meant to frighten you, but to emphasize that prevention is always better than treatment. No matter how good that treatment might be, recovery from stroke can be a long, challenging process that affects not just the survivor but their entire family. Physical therapy, speech therapy, occupational therapy, these can go on for months or years. The emotional impact of stroke, including depression and anxiety, affects up to 1/3 of stroke survivors according to research published in the journal Stroke. The financial impact can be devastating, with stroke-related costs in the United States exceeding $45 billion annually according to the CDC. But here's the empowering part of this message. You have the power to change your stroke risk dramatically. Every choice you make about what you eat, how much you move, whether you smoke, how you manage stress, all of these choices are votes for your future health. When you choose to pay attention to these silent warning signs, when you choose to seek medical attention for concerning symptoms, when you choose to take medications as prescribed and make healthy lifestyle changes, you're taking control of your health destiny. It's also important to share this information with the people you care about. Stroke doesn't just affect older adults, it can happen at any age. The American Heart Association reports that stroke rates are actually increasing among younger adults, particularly those in their 30s and 40s. This increase is largely attributed to rising rates of diabetes, obesity, and high blood pressure among younger people. Women face some unique stroke risks that are important to understand. Pregnancy, birth control pills, and hormone replacement therapy can all increase stroke risk under certain circumstances. Women are also more likely to experience atypical stroke symptoms, which means they might be more likely to dismiss warning signs or have them dismissed by healthcare providers. The silent warning signs we've discussed today apply to everyone, but women should be particularly vigilant about subtle symptoms that might be easy to dismiss. As we wrap up our discussion of these 8 silent warning signs, I want to emphasize that knowledge without action is useless. You now know what to look for: transient ischemic attacks, unusual headaches, vision changes, speech difficulties, balance problems, unexplained fatigue, cognitive changes, and intermittent numbness or weakness. But knowing these signs won't help you unless you're prepared to act on them. Create an action plan right now. Know who you would call if you experienced any of these symptoms. Have your doctor's contact information easily accessible. Make sure family members or close friends know about these warning signs so they can recognize them in you if you're not able to recognize them yourself. Consider wearing a medical alert bracelet if you have multiple stroke risk factors. Most importantly, don't let fear or denial prevent you from seeking help. Many people experience these warning signs but talk themselves out of getting medical attention because they're afraid of what they might find out, or because they don't want to bother their doctor or waste anyone's time. Your life is not a waste of anyone's time. These symptoms are your body's way of asking for help. Please listen and respond. Remember that stroke is largely preventable, and that prevention is always more effective and less costly than treatment. The 8 silent warning signs we've discussed today are gifts. They're your body's way of giving you advance warning so you can take action before it's too late. By recognizing these signs, seeking appropriate medical care, and making the lifestyle changes that support brain health, you're not just reducing your stroke risk, you're investing in a future where you can continue to think clearly, communicate effectively, and live independently for years to come. Your brain is your most precious asset. It's the organ that makes you who you are, that holds your memories, your personality, your ability to connect with others, and experience joy. These silent warning signs are your brain's way of asking for help. Please don't ignore that request. Your future self will thank you for the attention and care you give to these subtle but important signals today.